Bismillahirrahmanirrahim. Assalamu alaikum. Today, the topic of discussion is blood indices, and the objectives of the present lecture are determination of blood indices, know the normal blood indices values, and elaborate clinical significance of blood indices. Why determination of blood indices is important? The basic purpose of determine blood indices is to correct the fundamental results obtained in complete blood count. These are measurements that describe the size and hemoglobin content of red blood cells. And the blood indices are also useful to classify anemia. Mean corpuscular hemoglobin. It is defined as the amount of hemoglobin in average red blood cells. Mean corpuscular hemoglobin is equal to hemoglobin in gram per deciliter divided by red blood cells in millions per cubic millimeter multiplied by 10. Mean corpuscular hemoglobin is directly proportional to the amount of hemoglobin and the size of erythrocyte. Normal range is 26 to 32 picograms. So regarding its clinical significance, low mean corpuscular hemoglobin, that is less than 26 picograms, indicate microcytic hypochromic anemia. For example, iron deficiency anemia and thalassemia, while raised mean corpuscular hemoglobin, that is more than 32 picograms, indicates macrocytic normochromic anemia. Mean corpuscular volume, it is defined as average volume of single red blood cell in femtoliters. Mean corpuscular volume is equal to hematocrit or packed cell volume divided by red blood cell count in millions per cubic millimeter multiplied by 10. So it provides information on red blood cell size. Normal range is 78 to 95 femtoliters. Regarding its clinical significance, low mean corpuscular volume indicates microcytic anemia, that is iron deficiency anemia or thalassemia, while high mean corpuscular volume indicates macrocytic anemia, that is vitamin B12 or folic acid deficiency, while normal mean corpuscular volume 78 to 95 femtoliter indicates normocytic anemia. You can see the morphological types of anemia: microcytic hypochromic anemia, microcytic normochromic anemia, while normocytic normochromic anemia, macrocytic normochromic anemia, and macrocytic hypochromic anemia. And you can see the levels of mean corpuscular volume and mean corpuscular hemoglobin. Mean corpuscular hemoglobin concentration. The mean corpuscular hemoglobin concentration is the average concentration of hemoglobin in each individual erythrocyte. Mean corpuscular hemoglobin concentration is equal to hemoglobin in gram per deciliter divided by packed cell volume multiplied by 100, or mean corpuscular hemoglobin concentration is equal to mean corpuscular hemoglobin divided by mean corpuscular volume into 100. It is measured in grams per deciliter. It can be expressed in percentage. Normal range is 32 to 37 gram per deciliter. Clinical significance. Low mean corpuscular hemoglobin concentration, that is 32%, is indicates hypochromic anemia, that is iron deficiency anemia and thalassemia, while high mean corpuscular hemoglobin concentration more than 37 percentage it can occur in marked spherocytosis. Color index is another blood index. It is defined as ratio of hemoglobin with red blood cell count. So you can see here hemoglobin in percentage and RBC count is also in percentage. For RBC count, 100% is equal to 5 million per cubic millimeter, while for 100% is equal to 15 grams per deciliter. So the hemoglobin, when it is in 100%, it is equal to 15 gram per deciliter. These percentages are irrespective of age and sex. Normal range is equal to 0.8 to 1.15. High color index indicates pernicious anemia, while low color index indicates iron deficiency anemia. So you can see here hypochromic, normochromic and hypochromic. Three categories of chrome and three categories of size, that is macrocytes, normocytes and microcytes. Summary of red cell indices, that is normocytic, normochromic. The three indices, mean corpuscular volume, mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration, are normal in normocytic normochromic anemia, while in microcytic hypochromic anemia all the three indices are decreased, and in macrocytic normochromic anemia mean corpuscular volume and mean corpuscular hemoglobin are increased, while mean corpuscular hemoglobin concentration remains normal. So it is all about the indices, blood indices. If you have any query, you can contact me. Thank you.